All right. Hello, everyone. Welcome. We'll give everyone just a second to join. Welcome, welcome. All right, we're going to go ahead and get started. We got a lot of good content to cover today. Today, you're going to be hearing from the Wider Circle team on engaging Medicaid members in changing policy landscape. Before I turn it over to the team to get started, I do just want to mention a few housekeeping items. So you will notice for the duration of the webinar that your cameras and mics are going to be off. This is just for your privacy. So if you have any questions at all, please feel free to put those in the Q&A box down at the bottom of your screen where the little question mark is. The team's going to do their best to answer all of these during the webinar. However, if there's any that they can't get to, they'll follow up with you directly afterwards. Also want to note that Rise will be sending you a copy of today's slides as well as a recording tomorrow from rise.org. So without further ado, I'm going to turn it over to Bill to get us started.
All right. Thank you, Bailey. Appreciate it. Welcome, everyone. I'm Bill Friedman. And today we are going to talk a little bit about our work together with CareFirst. We've been doing that work together for about 18 months since 2024. And we'll talk a little bit about our program, which the Wider Circle program is designed to engage members where they live, hyper-locally, to really reach out in the way that they want to be contacted, that they want to be reached, to reach into their heart, to build community for them, to give them purpose. Most of all, it's really about building trust and then taking that trust and leveraging it to move the needle on engagement and really deliver messages that, more importantly, will not just be received, but that will be acted upon. Today, we're going to focus a little bit on the changing policy landscape and how the rules of engagement have changed a little bit and what makes connecting with folks locally even more important than ever. So we'll get started with some introductions. We'll talk a little bit about the nuts and bolts of the program. We'll talk about our work with CareFirst in Maryland. We will talk about some stories and really have a conversation about what it means to implement a program like this and what it means to members. We'll leave plenty of time at the end for some questions and answers, so feel free, leverage the chat bot and the chat box, excuse me, and put your questions in there. We're happy to take them. And if we don't have time for all of them, we're happy to connect offline and answer them as well. So, as I said, I'm Bill Friedman, Vice President of Payer Engagement here at Wider Circle. I come from the payer world. I spent many years on the carrier side, leading sales teams in both the commercial as well as the government program space. About a decade ago, I transitioned over to the vendor solution side of the equation, helping programs focused on social determinants, focused on member experience, focused on member engagement, deliver their products to market. And I'm joined by a couple of very esteemed panelists today. I'd like to introduce Yara, who will, hi Yara, introduce yourself.
Thanks, Bill. Hi, everyone. My name is Yarl Bishbishi. I am a senior business consultant with our Maryland Medicaid plan at CareFirst Community Health Plan of Maryland. I have been in the Medicaid space for about a decade, leading at CareFirst. I lead our innovation work, which centers around how do we engage our members, how do we learn who our members are, their greatest needs, and tailor not only an engagement plan around their needs, but delivering and executing on making sure that we communicate that and close the loop with our members through their experience and overall lead our strategy execution as it touches our Medicaid retention growth strategy. So excited to be with you this afternoon. Melissa?
Thanks, Yara. Melissa?
Awesome. Good afternoon, everyone. Melissa Gallagher. I lead our account management and customer success functions here at Wider Circle. I've been here for about 4 years. We support everything from sales handoff to implementation to steady state operations. really trying to ensure that we're delivering strong execution for our clients, which equates to oftentimes high client satisfaction. But more importantly, I think what you'll find is a consistent focus on building long-term strategic partnerships with our plans as well as our members. I've been in the healthcare space for about 20 years. I started my career in the risk adjustment space, helping to lead a healthcare startup through private equity and ultimately IPO, which gave me some deep experience on scaling organizations through significant growth and transformation. Looking forward to speaking with you today. Thanks for joining.
Thanks, Melissa. Maybe just to kick things off, just a little bit about Wider Circle. We have been in this space since 2015. What we're going to talk about today and the work we do with CareFirst is focused on our Connect for Life program. That is our flagship product, which engages people locally in the various communities where they live. We deliver that program in the local language with community health workers who know the local landscape, know the local customs, know the challenges, and also know the solutions in the places where your members live. We're really a tech-enabled company. There's a lot of tech that goes into what we do, but most of all, we're about people. We're about helping people address their needs, health-related social needs, and we are also about our ambassadors. So you might hear that word come up today in our conversations. Ambassadors are your members who take a larger role, who want to have their voice heard. And I'm sure in the course of our conversation today, we'll talk about a few stories where people actually are getting involved to a much greater degree than the typical health plan engagement. And we do all of this with an eye towards improving quality measures, health outcomes, HEDIS, member experience, you name it. We have been through a Milliman methodology review, so there is a lot of science behind the work that we do. And of course, we do this for many carriers throughout the country. Yara, maybe I'll pass it back to you to tell us a little bit about CareFirst.
Thanks, Bill. So CareFirst, BlueCross BlueShield is a not-for-profit health insurer in the Mid-Atlantic region. We serve approximately 3.5 million lives in DC, Northern Virginia, and Maryland. And our conversation this afternoon will be centered around our Maryland Medicaid plan. So CareFirst Community Health Plan Maryland is statewide in Maryland, and we cover about 110,000 lives. So a little snapshot about us here at CareFirst.
Thank you. A little bit about the program that we deliver for CareFirst members. It really starts with building awareness. It starts with outreach. How do we do that? There's no great secrets to that. But one of the secrets that we have found to touching members is that we have to help them. We have to give before we get. Before we get a member's trust, before we get them to buy in, we have to help them, right? We can't just call a member and say, I need you to do X. I need you to get your annual wellness visit. I need you to do something for me. We want to do something for them. So we do that. We try and solve problems for them, whether they be food problems, childcare problems, housing problems, utility problems. Once we've done that, once we've engaged, we've built that trust, we're then able to bring members together virtually as well as hyperlocally in local communities. We bring those members together because we want members to help each other, that people trust their friends, people trust their neighbors. They don't necessarily trust somebody who just happens to call them on the phone, but they trust people they know. They take advice better from people we know. So we onboard folks into this program. We have a comprehensive program of community events, again, both virtual and on-site. And then we build that community. And over time, when needed, we can then have those one-on-one conversations to help that member solve a problem to an even greater degree because we have that trust. Again, we've been through a Milliman methodology review, so there's a lot of science behind what we do. We're always measuring our engagement, we're measuring our results and delivering those results back to our payer partners. We have been through not only Milliman reviews, but we have actually been published in clinical journals. So this is a peer-reviewed study on health equity and outcomes with our program. Happy to share any of that documentation. Just shoot me an email and you'll have it before you know it. So we're solving that last mile of engagement with this community-based program with peer support and delivering validated outcomes. So with that, I'd love to dive in a little bit to the discussion. So maybe to start off today, I'd love to talk about some of the shifts that are happening in the Medicaid policy landscape right now. There's HR1, there's redetermination. Yara, maybe you can help walk through what you're feeling as a health plan with all these little different policy shifts and regulations coming down the pipe.
Yeah, absolutely. So I think the biggest shifts right now that's taking place is twofold, especially with HR1 or OBA, depending on how you describe it. One is around redetermination, and the second is around uncertainty. So addressing kind of the louder first, there was a time where Medicaid wasn't out in the news a lot. It wasn't communicated tremendously around what's going on, what's happening. And now there's an influx, right, with the new bill being passed last summer and the Medicaid provisions that are going to be impacting our Medicaid beneficiaries. There's a lot of uncertainty. And with that comes confusion, with that comes lack of engagement. And there is assumption that if there is lack of engagement or communication with the health plan, at times, then that means that there isn't really anything changing, or, members feel like we will find them if there are changes that will impact them. That's not entirely true, which is why, as we look to engage our members and take advantage of programs that we have existing that engage members, we want to make sure that we are addressing these uncertain times at the forefront. The second piece is around redetermination. So with HR1, folks that will be Medicaid beneficiaries that will have to adhere to these both work requirements and redetermination, more frequent checks. There's a lot of question around where there are the communication methodology that's going to happen, whether from the state, if it's coming from us, that's the MCO. And so from a shifting perspective, there is a bigger instance of churn that's happening at scale of lost eligibility. And it's not due to individuals becoming ineligible for Medicaid, but more of procedural disenrollments. And so that is certainly one that we will have to address and combat here as we're approaching implementation here in January 2027. And so, definitely want to make sure that as we're talking this afternoon, definitely the program that we've been able to implement and thrive really with Wider Circle has allowed us to make sure that from a communication perspective, we're also able to be proactive. So lots of shifts happening, lots of questions, lots of uncertainty, but we're certainly confident that with programs like, Wider Circle, that we'd be able to proactively address them as we embark on implementation.
Thanks, Yara. I'm curious, how your plan, and maybe Melissa, from your perspective, other plans you talk to, many of our customers, how they're shifting their engagement strategy, right? Like what preparation is going on in the back end, in response to things like, redetermination.
I can go first from our client base as well as CareFirst included. I think plans are trying to really just drum up overall member engagement, no matter what that channel means. If it's technological, like a text messaging or email communication or some sort of internal app, they're trying to get their arms around how their membership wants to be communicated with, and it's not all via one swim lane. I'll quote Yara. She uses the term message sent doesn't necessarily mean message received. And so I think what we're starting to kind of hit on here is there's information fatigue and overload, and no one knows what to pay attention to. And so plans are really just trying to build that trusted partner connection with their members so that members know when they see a message, it is because they need to take action versus just really hammering out, various streams of consciousness around different needs. I think our community-based approach is also well primed to help support these, which is why a lot of partners like CareFirst leverage our services, because as Bill articulated, the peer-to-peer connection is really what drives some of that member trust. Members talk. Oftentimes members are in the same neighborhoods, having services through the same health plans, and inevitably in those conversations, if we can get them talking about how their engagement is going, what their experiences look like, things that they've heard and seen, that's going to help kind of build up an arsenal of a hum of a member saying, hey, we need to pay attention to this. Our health plan needs us to do an action versus it being, for the most part in the past, episodic. I need you to do something for me. We want members to really understand that we're here for them longitudinal, but that we also do need them to take appropriate actions when necessary.
To add to that from a plan perspective, engagement and member communications traditionally in past years have been very campaign focused, right? Email, mailers, reminders, and they tend to, in the past, right, to be very just identical, right? Regardless of a member's action. So we are very intentional in our communications, and I'll give you an example. If we have a reminder to our membership to go get a flu shot, we make sure that members that have interacted with that text and actually maybe click the phone number to call member services or our quality team or whatever the one call to action that we intentionally make sure there's one call to action, not numerous. We make sure we remove them from the denominator of reminders, right? What that does is we're not only acknowledging their action, but we're also thinking about it from a member experience perspective. If you were to get a text about a reminder of something you've already done, it's not really going to begin to foster that feeling seen, feeling heard, that trust that you want from a plan or even, a community partner such as Wider Circle. But the intention behind every message is something we certainly have dedicated time and resources to. And we utilize every data element that we have, right? So those open rates, those click-through rates, especially when you talk through text and whatnot, they're there for a reason. And so making sure that we're understanding what's successful and what's not and how we can pivot. So then to Melissa's point, my famous quote, just because we said we did it doesn't mean that the member understood it and understood what the action needed to be for them to not only take care of themselves, their family, et cetera, depending on what the topic is.
Thanks, Yara. I'm curious, we have all these stories, and just to throw this out there, are there anything that comes to mind? Like I know we all have these feel great good stories about this stuff, right? Where, we were able to touch somebody's brain, their heart in a way, right? To get them to take action where, in a normal situation, even if it's about redetermination, even if it's something like so vital to their continued coverage, but they're not necessarily going to take that step, right? Unless they have, there's just something, an additional ingredient there. And I'm curious, maybe you guys have some stories that you could share.
Yeah, Yara, you piggyback. I know, Yara, you piggyback. My favorite part of my job is sharing our member experience stories. So I'll share two that come top of mind. One of them is through a CareFirst member that joined our program. We invited her to a virtual bingo call to get to know us. We love games. Members love to participate, but they get to conversate during those meetings too with our community engagement specialists along with their fellow members in a safe place without, the need to be face-to-face. One of the CareFirst members actually attended that call and then felt compelled to show up to another one. She had so much fun. It created a safe environment for her to come out and talk to others. When she was homebound in nature, she happened to be pregnant. And that being said, Through subsequent engagements where Wider Circle reached out to say, how can we help you? Are you in need of anything? Do you have any health related social needs? Do you understand your benefits? Just more navigation and life needs support. What we find in Medicaid populations is that they often need more than just a reminder to go to the doctor. They're needing food, they're needing transportation, they're needing navigation support about how to go about daily living and supporting themselves and their family. And through those conversations with this one particular member, we ultimately found that she was in a support network through our program where she was meeting with fellow pregnant member through one of our programs on a recurring basis. And when she went into labor and subsequently gave birth, she didn't want to let her members down, her fellow CareFirst members. So she actually dialed in to our call while recovering in the hospital to share the news that she had recently given birth. And that she appreciated the support that she'd found through the Wider Circle programs, but also through her fellow CareFirst members. The second is similar in nature. It is a mother that was experiencing a loss of eligibility with one of her children. She had many children, and unfortunately, one of them, for some reason, from an administrative and procedural perspective, had lost eligibility. And she didn't know what to do, nor did she have the time to try to figure out who to call. We helped her navigate with some quick resources back into the state and CareFirst to get that child covered under the benefit program. Otherwise, she just felt paralyzed by not knowing which way to turn and to how to navigate this and make sure that her child had appropriate coverage. Yara, I'll turn it over to you if you have any that especially resonate as well.
Yeah, I think just continuing like the story of how it not only starts with the engagement with Wider Circle, but comes back to the plan perspective. So that first story about the mom, the member who dialed in from the hospital bed, she's actually pretty active now with our member town halls that we host. She comes in person. She brings she's a toddler now, but she brings her toddler with her. And she's pretty vocal as far as providing feedback that we can action on. So as the impact of this program and the engagement has not only, allowed this member to get the resource and support she needs for herself and her family and her child, but she's been able to be a wonderful asset for us to understand what messages is landing, what's not, and providing that real-time feedback as we have these quarterly town halls. So regardless of where the engagement is successful, right? Wider Circle being able to be that extension of us, especially in the field, in the community, in member zip codes, right? Where we're not sending members right across the state. It has tremendous impact of how we can not only operationalize changes, but thinking about the member experience around members sometimes get a text, and so they'll reach out to Wider Circle and say, was this a scam? And so it causes us to reevaluate particular messages, how we're communicating with members. Because again, when we spend the time to develop and design and think about how we want to portray it, it's not always received the way we intend. So just like a continuation of how it translates to us, it really is impactful to help us do better for our members and be there for them at their most vulnerable times.
When you talk about the member town halls, I'm also thinking about the community advisory board meetings that you host. And I mean, I'm a payer side. I've been in the thankless position of hosting these, right? And like making all these preparations and only, a handful of members take advantage and show up. I'm curious, I know we've had some great success in that area. It would be great if you guys would share that. I know regulators like to look at that, and it's a great story for them. But it's also a great story for the plan, right? That you get people out and you get people involved, you get people engaged. And an engaged member is going to be a member that's going to be loyal to your plan. They're going to be happy. They're going to be, going to tell their friends.
Yeah, absolutely. So I can jump right in here. So as I'm sure most of you on the webinar are aware, consumer advisory board meetings, CAB meetings, they might be called different in different states. They're regulatory requirement meetings where you host a set amount a year, and it is intended to collect feedback from members and also allow for that two-way communication that you may not be able to, obtain otherwise in a different environment. And so after we went live the summer of 2024 with the Connect for Life Wider Circle program, that was an area of support that we needed in terms of we weren't meeting the numbers to adhere to the regulatory requirement of having a set amount of members represented during these meetings, actual feedback, and so we can action on those. So Wider Circle assisted with, educating the member around what these cabs were, right? A lot of the feedback initially as we were as Wider Circle was inviting members to these cabs was, oh, well, what's in it for me? What do they want from me? Right. And so that allowed, right, that trust building to begin as far as nothing. They want to hear from you. They want to hear directly from you what's working, what's not working, what they can help with. You have a pharmacy question, pharmacy representation will be there and help you in real time. And so that fostering that trust around just being able to ask that direct question and Wider Circle, personally inviting individual members to the cab, allowed our cab meeting not only for us to meet our regulatory requirement, but at one point, our cab meeting had about 500 members attend virtually, and we had about 40, 50 members attend in person. Now, those of you on the webinar that are in the Medicaid space, getting a member to attend one of these meetings is a feat in itself. Hundreds and hundreds of members attending and being engaged. Our Q&A was definitely not quiet, which obviously we wanted the feedback and the questions, right? But it also allowed us to rethink how we presented this type of member forum to our members. So we carved out the cabs, right? Still needing to meet that regulatory requirement, but we created these town halls. So we hold them quarterly. They're both in person or virtual, depending on members' circumstances and if they can make it in person. And we have been thriving in attendance. We get feedback very consistently. And the best part about it is every quarter it puts us on the clock to take that feedback and let them know what we've been able to do with that feedback. So you said this, we were able to do this for you. And not only has created that trust and engagement, but it's allowed our members to see that we are there for them, right? We would not exist without them. And it's really been at the forefront of how we drive our member experience. And member experience is now a standing agenda item on our town hall. And I would say it's probably the most exciting agenda item that members are looking forward to, because that's when we are providing updates around what we're doing as far as like any communications that we're updating. We ask very open-ended questions and we welcome any and all feedback. So it's been great to see our cabs grow and us being able to have this problem of figuring out how we make sure that a member forum is delivering what members want to hear and see, and we're able to close that loop with them.
That's amazing. I'm curious, Yara, like when you take that feedback back, when the member, right, has an issue or says, hey, do you ever think of this, right? And you get that valuable feedback, like how do you broadcast that internally? Like how do you operationalize that and make sure that the change is made and that you're actually looping back with the member and saying, hey, you made a difference.
Yeah, that's a good question. So the town halls are certainly not a one team effort. It's across our entire enterprise. We have member services representation, we have pharmacy represented, members experience, obviously, our Medicaid side of the fence. And even our public policy team has been pretty engaged in the last couple of town halls, especially with the HR1 and OBA changes that are coming. And we approach everything with transparency and humility. At the end of the day, right, we're here to help them, and we are very open about if we can't solve this today at the town hall, we will follow up with you. And I think one of the indicators of success is that not only have we been able to maintain presence at our town halls, but we will see a little bit of growth from quarter to quarter of who attends. And our members are recognizing our team members that attend. And so we're building that relationship among team members and members. And there are some members to date that will email me and ask, if we can help them with this. And so as far as internal communication, right, we make sure that, it is a cross collaboration effort, but also that we are open to our members as we are internally, right, and communicating. Listen, this is something we have to solve for. It came from a member town hall. And we may not have the solution today, but if this is not getting us where we need to go and maybe it's impacting PCP utilization or whatever the case may be, it's our responsibility to figure out a solution to address it. So, in all honesty, the town halls and the feedback that we get from members have really helped us accelerate what we need to prioritize because it's coming straight from who we're serving.
Melissa, I'm curious how we, internally at Wider Circle measure that success, right? And report it back to the plan, right? Because we have all these positive stories, we have all this engagement. We're touching members every day, every minute, but we have to communicate that back. So maybe if you could share a little bit about the pathway and, a little bit about the metrics that we're delivering back to plans that, they can take to leadership and kind of show why this is important work.
Of course. I think first and foremost, we have a very collaborative relationship with all of our partners. I hope that Yara would, echo that, and she's spoken about it here. We have kind of a two-way pathway where we can help engage members directly with a specific stakeholder, whether it's a care manager, whether it's member services. But then our teams are also trained on some of the basics around how to help members navigate specific, benefits that the health plan might have. We do analyze, as Bill spoke about in our opening, we analyze kind of outcomes. We have a lot of reporting and a lot of data that's collected around how members engage with them, which pathways they like engaging with, and which steps they have taken. So for instance, if it's a preventative screening, if it's some sort of navigation issue, all that is packaged up in our data and sent back to the plan on a monthly basis so that care managers alike and other departments can see how the members are engaging with us. We try very strongly to make sure that members see us as an extension of the health plan, not a replacement. We want the health plan to know each and every conversation or a little snippet about those conversations and what the member was saying around their specific health-related needs or specific plan-related needs. And that allows us to measure that at the end of the program to really right-size the impacts that we've made, whether we've been able to help a care manager get in touch with someone that's been unable to reach, whether we've helped a member access appropriate care when they were utilizing the ER. All of that is captured within our system, within each of the actions that our teams have. And there's values associated with those that we can deliver back to the health plan. At the end, we just evaluated one of our most recent programs that we launched in the DSNP base as early as 5 months. We were able to track and monitor that via claims and quality data to really articulate what the value is of back to the plan in regards to cost savings, utilization trends, and even retention.
And Melissa, I'm just thinking out loud to some of our work with CareFirst, specifically the work we've done with the Hep C population.
Of course. So CareFirst came to us, and I know, Maryland is specific in regards to their needs around populations like Hep C. But what I'd like to draw attention to is the way that we can engage harder to reach and harder to comply populations. In the spring of last year, Yara approached us with a population cohort that had not been appropriately adjusted as Hep C. What our call to action was try to build trust with these members, build a relationship with them, understand why they might not be open to developing a relationship or have an engagement with their care managers. And when the time felt right, we helped them actually warm transfer into that care management team so that they could be managed appropriately and therefore rate adjusted. I'm excited to say that a year afterwards, we see some pretty compelling outcomes in regards to those adjustments that have, I think, been financially beneficial to CareFirst. But more importantly, the members are getting getting the appropriate care that they deserve through their health plan sponsor.
Thanks, Melissa. Yara, I'm curious, and my experience. Obviously, I've been working with you and your team and leadership for quite a while. You guys are super innovative. Like you go out to the market and you look and you say, what do we do well? What do we not? What does the market do well? Like, how do you make that decision to, like, why wouldn't you do this yourself? How's that?
Yeah, that's a good question. So trust continues to be a underlining issue in our healthcare system, in all honesty, even more so with Medicaid in the Medicaid space. At the end of the day, for us to be able to drive positive health outcomes, for us to be able to retain our members, for us to be able to grow, for us to be able to ensure we are getting members what they need to survive and stay healthy, we have to have a very clear understanding of who they are and what those needs are. When engagement isn't working and our traditional ways of engaging members is not working, you have to think outside the box. We have invested time and energy and resources in the innovative space because that is becoming an expectation now of plans and health plans for you to be a sustainable health plan, so to speak. It's not just about enrolling members. How do you retain them? How do you get them the care that they need? How do you avoid avoidable utilization such as ER visits? Um, and your engagement tactics haven't changed. So while, we have a number of innovative partners and benefits, what we like to call value add benefits, they're pretty intentional based on the population that we're serving and the goal that we are addressing. So with Wider Circle, you all are, an extension of us in the community because not only do you have a pretty intentional model of how you engage members, and I'll quote Melissa here. They like this, she likes to say, coffee before colonoscopy. At the end of the day, we want to make sure members feel like they have a partner in helping navigate this really complex nature of healthcare. And if any of us were to get a call asking, "Hey, can I schedule you for a colonoscopy?" most of us would hang up, right? And so there is this approach, right? This model that not only takes the human first before the patient and allows that transaction to be kind of thrown out the window and build that relationship so you understand who that member is and foster that relationship. It takes time, don't get me wrong. And so while we have to focus internally on other priorities, because everything cannot be a priority that you intentionally work on in real time, there are things that have to be you have to look outside the box and think about how you can not only address it, but address it where you're not physically doing it as a plan day in and day out. And so this is becoming a success story in terms of not only the level of engagement, but I like to say the proof is in the pudding, where there is levels of engagement that has been able to help us validate not this is not only working, but it's needed. And it's hard to shy away from innovation when the data and the feedback from members is telling you that something like this, bringing our health plan to their zip code, bringing our resources and how we can educate our members to their backyard is needed, and it's validated that members would not be able to get the support that they need if it wasn't for programs like Wider Circle.
I think it's pretty interesting, Yara, pretty funny. I'm at a conference right now this week. And literally every vendor is AI this, AI that. And here we are talking about something that is as old as anything in this planet of ours, right? It's communication. It's touching somebody. It's
Mhm.
reaching out and grabbing somebody and saying, "Hey, I'm here for you. I'm your friend." Right? This is a safe space. Um, I'm curious, you know, as you talk to leadership, right, and convey the value of a program like this. Like how much is going on in a plan like AI, right? And which should be that. And then we're talking about this, which could be, I don't want to say it's a mundane story, but it's a very human story, right? And it's not necessarily technologically cutting edge, but at the end of the day, plans don't do it. Yeah. So
So
sorry.
yes, we are in the world of AI right now. I will say, right, digital engagement, AI, we have to use the tools that we have available to us for us to be able to be successful, and we're in it for the longevity of it all. AI is wonderful for understanding impact, insight, and scaling, but we cannot replace human connection. It cannot replace human touch, and it cannot replace really emotions. So at the forefront of, AI really picking up steam, so to speak, um, you know, data and AI help us understand who to prioritize, help us parse through data that would take a human decades to go through. But at the end of the day, what really makes a difference is that execution. So is a bot calling your members, or is a individual, a human, right, that resides in Maryland, that understands PG County and knows who's working at the food bank down the street and is able to make that connection so you feel supported and not, talking to, a bot. I will say, even when I call anyone on the phone and it's a call center, I click zero as many times as possible to get someone to talk through, right? Talk to. So at the end of the day, using our tools and our AI to get to where we need to go to execute is, I think the perfect recipe. I think execution, and I would urge others, because we have not only been successful in that human to human connection, but it really goes a long way to make sure that members feel like they are supported by humans and not necessarily just a system or a bot, to help them get what they need.
Hey, Melissa, a question for you. As you, communicate the value of what we do to plans, um, obviously we have lots of programs in place to maintain consistency and maintain the integrity of our program. I'm curious, you know, what role, well, I shouldn't say what role, but how do we ensure that, right? Like, how do we maintain that consistency, right? Like, we're out in the field, we're working with members. Like, how do we make sure that folks are having the right conversations, right? Having the conversations that are going to drive the most value or move the needle on a HEDIS measure or a quality measure.
Of course, I think first and foremost, get really close with the plans up front. We understand which impacts will make the most difference to them and in which populations. Sometimes that gets into a granular level of detail that we need to hit this county within this demographic to really be able to move the needle on this HEDIS metric. And our programs can be strategic in nature, where we can be targeted and prioritize those members. In addition to that, I'll piggyback on what Yara was just saying. I don't think integration with tools like AI have to be an either or. I think they can, work collaboratively together and not in competition. And we've been able to leverage not just AI, but some functions internally to streamline our processes so that our community health workers or community engagement specialists can get back to building the trust with the member. But we can leverage whether it's technology or a specific team to help make sure that members take the actions necessary. So whether that's a strategic team making three-way calls into a provider's office or using some sort of tool to help schedule a visit, that allows our CEs to get back to making sure that we're building the right trust and that we're learning from members about what their needs are and we're translating it back to the plan. But it makes that team that's doing that action super effective in what they're doing, instead of trying to spread the net wide where you have one person trying to do it all. In addition to that, we do leverage technology. So where and when members want to leverage technology in some sort of a space, we have members that will text us to ask for resource assistance. We have members that like to self-serve for their RSVPs to events. We try to insert certain pieces of technology in the right places to accommodate that specific population. Then again, we have some members that pick up every single call that we make to them to check in to see how they're doing. And we have 30-minute conversations with them because they're needing that sort of advocate. They want to press zero, they want to talk to someone. And so I think that's really where we can be thoughtful as a community engagement based solution about kind of how we meet the marketplace in a broader scale.
Thanks, Melissa. Maybe as we kind of wrap things up here, maybe I'll close it out with this question. What does success look like if we get Medicaid engagement right? Maybe go first, Yara.
Yeah, so success, a couple indicators of success are around actual engagement and I think level of engagement, right? Um, we have members who have been engaged in the program up to a year. And as folks in the Medicaid space know, having continuous engagement from a Medicaid beneficiary for more than maybe one conversation is tremendous in itself, but for a full year is pretty incredible. Having another indicator of success, I would say, is around having a very clear understanding and a better understanding of what are these actual needs that members have outside of what we are able to decipher from possibly other tools, whether from a socially determinants of health perspective or from a, well, why is utilization so low? And so, under being able to have those longevity relationships and those building that trust with members has been able to help us successfully understand what members need for us to better understand from our strategy perspective and how we're tailoring benefits or whatever the case may be to our actual population. And so members not only feel heard, but they feel seen and that we are delivering on what is actually going to be receptive to members based on their needs, so to speak. Another indicator of success is members being proactive. So at times, right, Melissa and team will reach out and say, well, this member has this question and whatnot. At the end of the day, it doesn't matter to us where the member goes, as long as they are being proactive. They're asking, oh, can you help me schedule a dental appointment? Can you help me schedule XYZ? That proactivity is another indicator of success because we're not chasing members down to get them scheduled, but they know that this is very important for them. And I would say continuous, as the theme of HR1 and OBA, continuous eligibility and renewal. We have the bigger umbrella of retention. We have a tremendously high retention rate. And that 97% would not be possible without programs like this, where members feel supported, but also it causes them to not only pay attention, but have a sounding board. I'd like to say a safety net of knowing where to go. And at times, that first step is calling or texting Wider Circle. So it's a two-way communication, but it's allowed us to make sure that members at the forefront feel supported. And so if I had to summarize, level of engagement, engaged for longer than just a couple of conversations, proactivity from a member's perspective, and as well as continuous coverage with Medicaid.
Thanks, Yara. Melissa, any final thoughts?
No, I would think you hit it right on the head, Yara. What we're seeing from the most strategic partners that we work with, similar to CareFirst, is that they are trying to think in the proactive vein versus reactive. Unfortunately, a lot of healthcare is built around reactive processes. So you need to meet this metric, you need to get engaged with this member, you need them to do an action. But the ones that are really starting to level up ahead of HR1 are the ones that are trying to get a proactive line on their member engagement, building that trusted connection so that when the time is right, they're able to message the appropriate information and they have members that are wanting and willing to listen.
That's great. That's great. I want to thank you both so much for participating today. The great conversation, the great advice to plans everywhere. If there are any questions, feel free to put them in chat. We'll take a couple of them. if we can. One question that I see popped up a couple of times, and I'll just kind of paraphrase this, right? If you could give one piece of advice, right, to somebody running a Medicaid plan, and navigating the current environment, what would it be? Either or both.
That's, that's a good question. In the landscape of HR1 changes and redetermination, I would say go back to your team and look through your redetermination communication strategy. Think about it from a member perspective. If you were in their shoes, what is what points of friction are coming up as you are evaluating it from a member perspective, but also are you taking into account, right, state communications as well as your communications and how they're structured? Are you sending one mode of communication versus another? How are they kind of mapped out, especially as we get into HR1 and the 6 month eligibility checks with members who will become required to adhere to those requirements? Um, what does that messaging sound like? How, are those reminders the same as those initial communications? I think the member experience element of looking at communications is underestimated in terms of impact. And I'll tell you from experience and our own execution, when we went back and looked at our redetermination campaign a couple of years ago at this point, there were some gaps that we addressed early on, and it not only improved retention and cover, eligibility and members continuing to be covered, but we also saw more engagement with those communications, whether it's open rates with emails, whether it's those text messages. And so let the data guide you. And if that is continues to be a gap, the power of communication can go a long way if it's intentional and data driven.
Well, thank you both so much. It's really been great conversation. Really appreciate both of you participating. Thank you to everyone who joined us today. If there are any additional questions, comments, suggestions, if you'd like to reach anybody who was on the webinar today, feel free to reach out. You can always reach us at Wider Circle. You can shoot us an email. You can please feel free. Here's my email right there. And I'm happy to take those emails and distribute them to Yara or to Melissa. Or if the question's for me, I will answer it directly. So thank you everyone for participating today. With that, I'd like to hand it back to Bailey at the Rise organization.
Yeah, thank you so much to the team for sponsoring today's webinar and putting on a great presentation. Just a reminder, whenever you close out your screen, you will see a webinar survey pop up. So if you could just take a few moments and answer those few questions for us, that would be greatly appreciated. And then just another reminder, you will be receiving a copy of today's recording, as well as the slides tomorrow from Rise. And with that, it concludes today's webinar, and we look forward to seeing you all on the next one. Have a good one, everyone.
Thank you, everyone.